Welcome, everyone. We're waiting for a few more attendees to join. We'll start shortly. Thank you. Once again, welcome, everyone. We're waiting for a few more attendees, and we will start shortly. Thank you. Welcome, everyone. One more minute, and we should get going. All right, let's start. Good morning, good afternoon, everybody. Thank you for joining MMB's Health Trends Insights webinar. My name is Jamil Kabaj. I'm the Risk Management Practice Leader for Mercer Marsh Benefits in the UAE. We're joined today by four great panelists that will help us explore and understand some of the key health trends expected for 2022. Ivana Premel, who is the Senior Total Rewards and Employee Mobility Manager for Nestle in the MENA region. Andrew Stocker, Employee Benefits for MetLife Golf. Asad Kassas, Placement Leader for Marsh UAE. And Andrew Brody, who is the Client Relationship and Consultancy Leader for MMB MENA. Thank you all for joining today. In late 2021, Mercer Marsh Benefits surveyed 210 insurers across more than 50 countries to gain insights into the top health and benefit trends for 2022. The clear outcome is that the employee health and benefits landscape has changed. We're seeing a change in the way employees value and use benefits. The value organizations provide to their employees and people in general is becoming as important as cost. And I think ultimately a well-designed benefit plan can be a competitive advantage for organizations. From a global perspective, four key trends that are shaping employer-sponsored health and benefits were identified. Increasing medical rates and claims, and I think this is common, has been common for a number of years now. COVID-19 still impacting the claims experience of benefit plans. Prevention and self-care being now needed more than ever to mitigate these health risks. And health equity in medical plan being a growing priority for many organizations. Maybe starting with Andrew S. Clearly, we're no longer operating in the same environment as before. What has your experience been as an insurer in terms of a changing health and benefit landscape?
Thanks, Jamil, and welcome again to all the guests. Thanks for putting this on. I think it's great. So I think there's a few noticeable changes. I think some of them are consistent with what you've shared here. Maybe I'll get a little bit more granular. First of all, I think around maybe health equity, we've seen a noticeable increase in new requests for benefits that historically maybe haven't been present or have been present for certain classifications of employees within a population. Let's take, for example, and I think it's widely known that there's an increase in requests for psychiatric and mental well-being benefits on a direct billing basis. So simplifying access to care when it comes to psychiatric and general mental well-being. I think the second is an increase in flex benefits. So let's define that as creating more choice for employees, maybe not so much the funding mechanism of benefits plans, but allowing employees to have more choice in selecting benefits. And I think we know that that is more mature in other parts of the world, and I think is just beginning to become an important part of the benefits landscape here in the region. And then the third might be, and I think we did a similar market science study of employers and found that although cost still remains the primary driver for employers in making their decision of insurers, there is a flight to quality, and that quality might be demonstrated best in an insurer being able to meet the evolving needs of a customer in the market. So I think maybe those two or three of those items you pointed out there on the slide means that employers are evolving their needs quite rapidly, many times with feedback and consulting from likes of MMB. And comp, ben, HR, they all have a very diverse set of evolving needs. And I think looking for insurers that can fit the flexibility that's needed, that probably has become more of an important part in kind of the healthcare and benefits landscape when we think about the relationship we have with customers.
Absolutely, thank you for that. And Ivana, from an employer's point of view, at the start of the pandemic, did you anticipate that the environment would change so much? And I guess a follow-up question, would you say you were prepared for seeing some of the changes in terms of ways of working and the benefits that are now required by employees and organizations?
Thanks, Jamil, and hi, everyone. Look, I don't think anyone has been prepared when the pandemic started. And if we go back kind of like 12, 16 months into the pandemic, people were at that point still referring to when we go back to how it was. So I think that everyone was in a situation of being caught off guard, and everyone was like expecting that it's soon going to go away. And no one was accepting the fact that everything around us is changing, and no one had an idea on where we are going to be today. So that being said, to go into your second question, I think it has been also pretty obvious that none of us have been prepared. I would say that there were companies which were way much better prepared, companies who at that point had potentially some well-being programs in the organizations, companies who already had EAPs in place, companies who already had different well-being offerings. Have we been prepared? No, we haven't been prepared. We did have already an extensive medical insurance in place. We did have an EAP, but we haven't done a proper marketing about all of those programs that we were running at that stage. And pretty much we started everything from the scratch at the point when the pandemic started. So we really needed to invest a lot of the time and effort into bringing change for an employees and bringing a support to an employees, given the fact that the support that employees were asking for has tremendously changed. Today, many moons ago, we are now, many moons ahead, we are now in a better space, but I think that pretty much we still have a lot in this space to change.
Absolutely, and I think some of the trends that you've highlighted we will cover a little bit later during the discussion, and obviously based on the results of the survey and some of the feedback that Andrew S. and Ivana have shared. It's really obvious that the pandemic has had a significant impact on benefit plans in the region and globally. And maybe one for Assad, would you say the biggest impact has been on claims and increasing costs, or was it more around working behaviors and diversification of workforces?
Thank you, Jamil. To be honest, I think it's basically the implication was on both. So looking back, for example, at things that have happened during the pandemic, I mean, there was an impact on working behavior. So we've kind of seen a shift from being at the office to working at home. There was a diversification workforce where it kind of implied that companies might have went to outsourcing, for example, compared to just normal employment hiring as it used to be in the past. But still, that had also a direct impact on claims. So we've seen that there was a significant reduction on claims during pandemic when it came to around claims reporting. But then the minute we started off the recovery aspect of getting back to normality, that's when we started seeing claims started to pick up again. And that's mainly on the elective cases, not the emergency ones. So there has been an impact. There is also probably indirect impact on medical inflation caused by the inflation that is happening as we speak now, which may have an impact also on that in the future.
Yeah, no, absolutely, and I think some of the key trends that we're seeing globally are also replicated in the MENA region specifically, and I would want to move into the MENA 3 key trends that were identified in the survey. One is employers are impacted by the changing in health and benefit landscape. Obviously, it is a fairly broad subject, but I'm going to try to drill into that a little bit more. COVID-19, similar to what we've seen globally, continues to impact healthcare in the region. And we're seeing, like Ivana mentioned, a bit more focus on employee well-being and mental health support for the overall population insured in benefit plans. And I think, I think the first big question, and maybe one for Andrew B, do you think most organizations are sufficiently prepared to manage the changing health and benefit landscape? And obviously there's various levels to that. And maybe a follow-up questions, what do you see as being some of the primary obstacles for that change?
Sure, thanks for the question and welcome everybody. I think organizations continue to try to balance the need to have a robust plan design that helps them to attract and retain talent, and also to manage the costs of that benefit plan. But it's not necessarily the case that adding things to a plan design necessarily adds costs in all the same ways. There are things that you can do to improve your plan design that don't necessarily add those costs. And in fact, there are things like telemedicine, I think somebody just mentioned in the chat, which could actually help you reduce your costs, because the cost of a consultation by telemedicine is much less than an in-person consultation. So you have that dynamic, but you also asked about the barriers, and I think for me the key thing is data, or more to the point, the lack of robust data and analytics is a barrier to an organization trying to manage this shifting landscape, because it's the data that tells you actually what is driving your claims trend, what's driving your claims performance. And no two organizations are alike. I mean, we definitely do see things like what we have here, like, there's a rise in non-communicable diseases, but it's not the only factor. And the truth is that we have different remedies for different cost drivers. So it's really important to use data to understand what's going on with your claims, so that you can make the right decisions and address it appropriately. And generally, what we found is that organizations that utilize data are at an advantage in managing the shifting landscape versus organizations that don't.
Yeah, no, absolutely. And like I mentioned earlier, the landscape is a fairly broad term, and I think another key element of that change is regulation, and regulation coming in quite quickly in the region. And maybe one for Assad, given your regional exposure, our business is prepared for the upcoming regulatory updates that we're expecting in the region, GCC mainly, but obviously other countries across the region as well, moving into that direction as well.
Well, to be honest, I think, of course, they should be ready, to be honest. But it's always good to keep a watch out for any updates on regulations that might be happening. So, I mean, looking at, for example, the UAE, anticipated change in COVID management from government to insurance sector might have an impact. For example, the golden visa, for example, implication on let's say the age band of the workforce, where people are meant to stay longer, which means it might require higher age bands to basically be insured. And even retention factors when it comes to employers now retaining their employees, for example, might end up impacting as well, schemes performances. But looking at other countries, for example, in the GCC, like KSA have introduced now recently a new CCHI update, or the Cooperative Council for Health Insurance. They've introduced a recent update that starts hopefully next month, which we foresee with the enhanced benefits that have introduced, it will have an impact on claims performance and on claims cost. We also kind of understand that Bahrain, Oman, and Qatar, they should be introducing their own set of mandatory regulations quite soon, which requires also employers to be ready and to anticipate, changes in healthcare systems and in the way that they used to kind of manage claims costs in the past. So those are all kind of updates that are happening in GCC, and of course, it's advisable to employers to keep an eye on that moving forward.
So definitely a lot of changes in the region, and with that, the survey has shown that 48% of organizations have made changes to their benefit strategies because of the pandemic and this change in landscape. And maybe it would be good to hear from both Andrews, and starting with Andrew S. Do you think there has been a shift in the mindset of companies balancing the cost of providing benefits on one side and the well-being of employees since the start of the pandemic? And would you see a differentiator between multinationals and more local-oriented companies?
Yeah, thanks. The prior slide too, I concur a lot with the data that you guys were able to pull from your surveys. So I think it's telling, good information, and I see a lot of questions coming in through the chat. As I mentioned in my last answer, we did a survey around what we call perceived or actual purchasing power, the reason why employers make decisions on health insurance benefits. And to answer this question, I think I'll go to what I saw from what the employers' answers were, which is cost, I think, remains the primary actual purchasing reason, right? However, when you ask the question around perceived purchasing reasons, in comes this entirely new aspect around, I mentioned it earlier, flexibility of evolving needs. And those were defined more as, in the post-COVID environment, we see a need for differentiating factors in our benefits plans that include things like preventive health, mental health, and wellness programs. These would be things like chiropractic treatment benefits, homeopathy, things like this, right? So you could probably be quite general in what that category is for many different employers. They're going to have different needs. So I think that was new, right? So in the past, that might have fallen to the third or fourth reason why employers perceive, or their perception of why they make decisions. The actual decision, I think, still remains to be cost, but it's more balanced. And I think one of the other things that came post-COVID that we didn't see pre-COVID was this desire of employers to say, okay, what's driving my cost? And help me control the cost. Give me good reasons and give me good ideas, constructive ways in which I can control cost. Not so much in the past, just find me the lowest insurer, because I think, again, what they're looking for is that balance of a health insurance plan that can provide that best in quality and flexibility to meet the needs that are evolving, but at the same point in time, provide a great deal of transparency and data for either their consultant or their insurer to help them mitigate and control cost over time.
Okay. And Andrew, anything to add to Andrew-'s answer?
Yeah, no, I agree with everything Andrew S. has said. I think there is a recognition that the workforce is diverse and that people have different needs, and sometimes these needs change over time. And when I say diverse, I don't necessarily mean by nationality or by gender, although that is there, but also by lifestyle. I mean, you have people that are single, you have people that are families, you have people that have families with older kids who are outside the house, and then families with younger kids. So the needs are different. And the shift in the mindset that we see is also, there's increasing demand and questions about flexible benefits and how we can provide employees and empower employees with the ability to choose benefits within a context that suit their lifestyle or suit their needs, which again change over time. So that's some of the shift that we see in organizations today.
Thank you for that. And maybe one for Ivana, from an employer's point of view, obviously we're talking about companies needing to change strategies given the change in landscape. Some companies are more advanced than others in this change. For companies that still need to undergo a certain level of change, how should these organizations change the strategies to manage health risk and cost in general, in your opinion?
Well, I think that one is a tricky one, because predominantly, if we look in the past, how we were looking into our medical programs in the companies, it was like, we are providing you medical insurance, and this is pretty much where we stop. And then every year we would go into trying to just negotiate the best price for us. Throughout this period, to already what Andrew S. and Andrew B. said, the dynamics have changed. Employees are looking for new things. Automatically, the new things that we want to bring are now also having an impact on our costs. So pretty much what we started doing is we started looking into the employee health outside of the medical insurance only. It needs to be an end-to-end program that starts with employees while they are still healthy. We cannot go to the point that employees now severely endangered, has severe concerns and health issues, and then starting treating an employee. So we need to start way much before on raising the awareness about employees taking care of their health and us trying to support them through that. So it is going to be extremely important that the companies are going to start having a bigger emphasis on well-being programs. What is involved in those well-being programs? Are we looking only at the physical? Are we looking on physical and mental? Are we also looking into financial health of our employees, and how we position and how we care of our employees before the major health issue happens? And then, of course, something that we also needed to do, and that what we need to be open into, is that at some point we will have to also involve employees into being responsible for their health, through potentially co-pays, participating in their health. Because if we don't do that, then we are only seeing the increase. And at that point, we are not able to disperse and do various things and invest in various different things that employees are going to benefit from.
Absolutely. Thank you for that, Ivana. It's great that you brought a few key points, I think, that we're going to be again covering a little bit later in terms of mental health, well-being, etc. So I think it would be good to also get some further insights from everybody at that point. Moving on, maybe a little bit, and maybe linked to the change in landscape, and it's a recurring theme, is the impact that COVID-19 has had, and I think every panelist has mentioned that as part of different answers throughout the discussions so far. Looking at the actual now cost of claims in benefit policies, and whilst the focus is usually on medical, we've seen also some increases in life insurance as well. But coming back to medical, 62% of insurers in the survey believe that medical claims will surpass pre-COVID levels in 2022. And maybe one for Andrew S. You seem to be the obvious person to go to here. How are you expecting claims to evolve in 2022 from your side, I guess, given the range of health issues brought on by COVID and the change in landscape? And maybe a follow-up one is around, are we past the deferral of care experienced during the pandemic, or are we expecting further deferral this year?
Yeah, maybe this is a fascinating topic, and having been in the industry for 20 years, probably we've never seen a moment like this, which we would define as the last sort of 2.5 years. Maybe first I'll answer that last question, which it seems to be the answer is yes, that the elective conditions that we saw in 2022 and the general deterioration of health we saw, or the severity index in diseases that we saw in 2022, appear to be normalizing. So, but maybe let me just then go back a bit and talk about maybe the mechanics of what we've seen. So if we go back to pre-COVID, late 19, insurance companies will generally predict medical trend in the form of two ways, and they'll predict forward for a period of 2 years. So in late 19, as we normally do, our actuaries would predict trend, and that trend would be predicted in two ways. One is utilization, which is the number of members of a population claiming, and then the number of claims they have. That's utilization. The second is the cost of claim. And the cost of claim is made up by the severity of the claim and severity of and cost of medicine attached to that claim. So the types of diseases you're seeing and where population is going, what type of providers they're going to seek treatment. So that's what cost of claim is. And so we predict that. And generally you hear these numbers like 9 or 10% trend annually. I think it was on your last slide, 10% trend in the region. And that's how we try to project trend in the upcoming years. If you skip 2020, which was a very unique period where the incidence levels were extremely low because people were not claiming. Either they were locked down or they were choosing just not to go to providers. If we look at 2021 as a period where incidence levels and people began to return back to providers, what we saw in 2021 was a general increase from 80% of pre-pandemic utilization to, at the very end of December 2022, back to 97% of expected utilization. So that meant at the end of 2022, we were almost back to normal utilization expectation that we had set in 2019. Okay, so it was a general gradual increase over 2022 or 2021, sorry. At the start of 2021, the cost of claim was up 15%. And that cost of claim in 2021 was driven by three primary factors: the severity of the diseases that were being treated, the cost of the medicines that were being prescribed for those conditions, and the third was where members were seeking treatment, which generally was more so in hospitals than in clinics. And that could be severity or that could be by choice. So in 2021, insurers, I think in general, and this supports your slide and your comment earlier, cost of claim was up 15% in 2021 over what we had projected it to be prior to COVID. And that was that sort of reflex to people going back and having either elective treatment or people whose health had deteriorated in 2020 now seeking treatment in 2021. So that was what 2021 looked like, is that you had a total cost of trend that was 4% higher when you factored in utilization and you factored in cost of care for the entire of 2021. Trend increased by 4%. So instead of it being normally about 8, it increased by overall 4%. Now that was in the period of 2021. The good news, as I started with when we talked about 2022, is it does appear that cost of claim is going down. Utilization is at the metrics we expect it to be in 2022. So that means we're back to pre-pandemic expectation for 2022, which means people are going to providers and they're seeking care. Cost of claim is going down. Now, it's too early in those first 4 months to determine, is it severity? Is it cost of medicine? Or is it where people are going? Are they going back to clinics now versus hospitals? And so we'll probably have a view on that in 2 months, the first half of the year. And I think that's going to tell us whether we're on a new track or whether we're back to a track that we had projected pre-COVID. It was a long-winded answer, but it gives you kind of a perspective of what we saw in 2021 and what likely we think we're going to see in 2022.
You know, I mean, it makes perfect sense, and I guess we're all hoping that there's going to be a slight shift in the mindset of the end user when it comes to accessing care that will help, I guess, employers control cost moving forward and being a little bit more involved. And I think a key element, given the increase in cost, but also the increase of need of additional support for employees. There's been a wide range of additional, if you want, add-ons added to benefit plans, and we've spoken about a couple of those previously. I'm just giving you a couple of stats. So 36% of companies have included an employee assistance program in their benefit plan during the pandemic. We've seen 27% that included a telehealth support for employees, and this is outside the mandated DHA and had telemedicine workings with providers specifically. Now, the main trouble is that utilization of the tools remain extremely low, and we're looking at numbers between 1% and 8%. And maybe hearing from Ivana and Andrew B here, what do you think are the main obstacles to increase utilization of EAP in one way, providing additional support and ensure that members use the tool? So it shouldn't just be simple decoration to a certain extent of a tick box from an employer perspective, say, okay, well, I've given this, I am where I should be. It's trying to promote that as much as possible. But I think even more importantly for the mitigating those risks and cost risks as well is increasing the utilization of telemedicine. So what do you think are the main obstacles there? And maybe starting with Ivana.
Look, when it comes to the EAP, we had a tremendous hike in the utilization of the EAP somewhere like around 2020 and early 2021. I think people were significantly impacted with all the changes which are coming with COVID. And, people at that point started realizing, okay, I can't go through this alone. Let me use this EAP thing that my company constantly does marketing about. Let me see what that is. But what is currently happening again now with us coming to the new normal, no one wants to utilize employee assistance program. And we are trying to look into like, what is the reason of like people utilizing EAP in 2022 above our expectations, now again going into a situation where our utilization is below 1%. No matter that the level of marketing, level of announcement, level of talking about it has stayed the same. But what we are realizing is that it comes back to, and employees are not in a direct need of EAP, and automatically they forget and they say, I'm going to look into this tomorrow. So what we are trying to now do in a company is like, we are trying to raise an awareness that you don't have to be in a direct need of an EAP in order to use an EAP, that you can use an EAP even if the severity of the situation is not as big as what has happened with the COVID-19. We are also trying to push more the EAP awareness to the family members. And this is where we always have an outreach which is lower than to the employees. We don't have the email addresses of the family members. We don't know what is happening in the families. We do not know how to reach to them. So we are trying to find the ways how to reach, also to raise an awareness of an EAP to the family members. But honestly, Jamil, it also comes down to where we currently live. It is hard to today say, I need an EAP assistance. It is hard to say, hey, I need to go to a psychologist and I need to ask for a help. So I don't think that this is something that we are going to change just by marketing, just by reaching to the employees, just by raising an awareness about this is not something that you need to use only in a severe situations. But we are also going to need time for the mentality and the whole perception of what EAP is from an employee to change in order to spike and increase the utilization. So it's going to be a combination of everything.
Okay, and from a telemedicine perspective, Ivana, obviously numbers remain extremely low, and you and I have had many conversations about this in the past. What do you think there? What can be done? What is the problem? Is the tool, and why are people not availing the telehealth platforms the way we would want them to do so?
I think that this is where we have to be like really honest with ourselves. Like the telehealth service is great, right? And it's probably great more for us as employers than for the employees. Our employees, their families, when they are sick, they want to go to the doctor. They want to see the human touch. They want to have the human touch. They want to see that someone who is a human check their child when the child is sick. And no matter how telemedicine has been attractive while we were in COVID, when everyone was afraid and everyone was scared, and then everyone was like, okay, yeah, let me use the telehealth and let me use this telemedicine button because I don't want to be more exposed. People now want to be kind of like calmed, and people want to be persuaded by a human being that everything is right. And coming back to my first point, that we need to be honest with ourselves. We need to be honest as an employer to say employees will always want to go to the doctor, and if we really want to make them go to and utilize the telemedicine, we need to either implement a carrot or a stick. There needs to be either a benefit of why you're using the telehealth, or there needs to be some small part of the punishment of go and use the telemedicine, otherwise we are going to punish you. And for instance, like this is something that we recently implemented for one element in our medical insurance table of benefit. And automatically, when we implemented the benefit behind that specific element from the table of benefits, we've seen the spike in a telehealth because an employees are benefiting from using the telehealth. So I really think kind of like we shouldn't be here lying to ourselves and saying like people are just going to use it because it's so nice. People are going to use it if there is either a benefit or a punishment behind, because we still, even us here on a call, we like to go to the doctor.
Absolutely, absolutely. Andrew B, anything to add on that front?
Yeah, I mean, not much. I think Ivana, you covered it pretty well. I mean, I don't expect that we're going to see, utilization go from 0 to 100% and completely replace the visits to doctors. There will always be that, people will always want to see their doctors. They want their kids to see their doctors. Their doctors know the history of the kids, and there is that. It's ingrained within us, right? This is how we were brought up. You go to see a doctor if you're sick. And so I think that's a normal behavioral pattern that we don't expect to change. But what we did see was that because of the pandemic, because of lack of options, whether it was lockdowns or people didn't want to go to the hospitals or clinics, we did see that spike. And then afterwards, what we saw is that people who tried the service, they kept using it. Not all the time, but they kept using it, whereas maybe they weren't using it at all before. Because what people found was there is actually a huge convenience to being able to access a doctor in seconds on your mobile phone, which, let's face it, is never far away from any of us. So there is that convenience to it, and it may still lead to an in-person appointment, but at least you have that people are usually utilizing a bit more. And I see Andrew Stocker as a I'll just add a couple more things. I think communication is key, but I think, like you, Ivana, I think you're doing that communications part. And yes, I think the financial component, a deductible or a waiver of deductible to encourage use of telemedicine is definitely going to improve the utilization.
Thank you, Andrew. We are a little bit pressed for time, but obviously we want to cover a few more topics. And I think one of the ones that seems to be coming back over and over through the questions and the panel discussion here is employee well-being and mental health. And maybe going back to you, Andrew B, do you think it's important for organizations to have an employee mental health strategy?
I think that nowadays, you hear these words. I mean, people are talking about mental health, mindfulness, wellness, well-being, in the context of an employee benefits plan a lot more than they were doing, 5 years ago, pre-COVID. I mean, COVID has definitely, pushed these things up into the regular discourse. So I think I do see a rising expectations by the workforce in that these benefits and mental health benefits will be added to the plan. So I do think that there is a need to have a strategy when it comes to these things. And my advice is really just to focus on two things. I mean, really just to measure and to maximize the employee engagement. So you can measure. I mean, you could just start with what you have today. You could look at your employee benefits plan and you can say, just understand, what do I have today? And maybe you don't have anything, or maybe you have something and you weren't all that aware of it, but add something to it. There's a range of options out there. I was commenting to someone on the chat. There's a range of options there. There's things that are fairly, low cost, to more robust things that are more expensive, but that do more. But you can start with something and then make sure that you are bringing your employees along on the journey. So make sure that you're maximizing that engagement, that the employees are aware of the benefit, that they're seeing the advantage of it. Because there's no sense in adding any benefit to a plan that nobody is aware of and nobody uses. So I think when it comes to, executing a mental health strategy, it's just important to measure what you have, make sure that you just continue to build on what works, and if something doesn't work, then you take it away and you try something else.
Thank you. Thank you, Andrew. Andrew, as first, sorry, I had not realized you wanted to add something on telemedicine. So maybe before, because I wanted to touch base with you on well-being and mental health, but obviously telehealth is very important, I think, to many people attending this call today. So any further insights or anything that you wanted to add on that front before we move back to well-being and mental health?
Yeah, thanks. I wanted to echo Ivana's comments about, these are humans and this is behavior, right? So when you get down to people's choices, and I think Andrew mentioned it too, when you get down to people's choices of where they are going to receive or want to receive healthcare, they're going to have their personal choices. And when we did our study in sort of October of 2020, when we launched Care Anywhere, which was our telehealth, our extensive telehealth services, we did a survey of about 500 or so members, asking them, during pandemic and post-pandemic, where is your preference of seeking care? And, no surprise, people said, I want to go and I want to see my physician, the physician that I've been visiting for years. And so that's a consumer choice. So how do you impact that choice? I think, first of all, it takes time to change that choice. So you can't change that overnight. Andrew's comment on what happened during the pandemic is an anomaly because people were driven to have to make those choices. But I think now that we're back into a sort of post-pandemic environment, it's going to take time. And it's also going to take, I like her comment, the carrot and the stick. As insurers, it's our responsibility to develop an environment in where it doesn't feel like a carrot and it doesn't feel like a stick, but it's all together a strategy that helps drive telehealth utilization. Look, the math is very simple here, at least for the Middle East. A 10% increase in telehealth utilization for OP care, we're just talking about OP care, not maternity and IP, derives a 3% reduction in overall healthcare claims cost. So the facts are there that there can be a significant impact on claim cost. The question is, how do you incentivize and develop the right clinical pathways for telehealth to become a chosen pathway? And that takes time, that takes strategy, and that takes data. So that was my response to that real quick. And then on health and wellness, I just want to echo Andrew's point. Throwing in health and wellness benefits is not necessarily going to have an impact on the employee's health, prevention, or ongoing care of non-communicable systemic diseases, right? Chronic diseases. I think it starts with engagement surveys. I think employers that use engagement surveys to understand the broad impact of whether employees are engaged or not at the company, and this is obviously a broad survey that takes into account, how people feel, whether they're engaged at work and so forth. But using the engagement survey to be able to get underneath some of the issues that are impacting employees' feelings about their overall wellness, and it's not, again, just physical wellness, but it's mental wellness and financial well-being, it's total well-being. That's where you have to start. And I think the second point is the data. And I'll maybe use this example. If an organization doesn't have a high incidence level of employees who are battling chronic diseases like diabetes and hypertension, if the numbers are below benchmark, yes, you want to have specific programs for those individuals to care for them, but that's not something that you want to develop in terms of a mass strategy around health and wellness strategies. So if the data tells you that, then you might focus on certain areas. If the data is telling you you have a higher incidence levels and a higher percentage of employees with diabetes and hypertension and chronic conditions, then yes, implementing strategies, long-term strategies on a mass basis to affect the population is the right approach. I think it goes down again to Andrew's point that it's in the engagement surveys and employee surveys that better understand the lifestyle conditions and concerns of the employees, coupled with medical data that's going to create a long-term strategy.
Yeah, no, absolutely makes sense. And maybe one last question before we move on, and coming back to some of the statistics that we've seen, 25% of organizations having enhanced their mental health cover in benefit plans throughout the pandemic. And from an employer's point of view, Ivana, do you think this growing focus on mental health will impact employers when it comes to talent attraction and retention? Or do you think it was more a pandemic related type of topic and may kind of move away from the main points that are discussed on a regular basis with employees and employers?
Look, I think that this is still more a benefit that starts being discussed once you are part of the company. And I think that once we hire you, and once you start seeing what we offer you, this is and what is happening around you, this is where you start asking about what do you have. As an example, like we still have employees who are joining the company, and the question that they ask is not, are you offering a well-being program? They are asking you, am I going to get a medical insurance? The candidates, they don't even go into asking, what is your table of benefits? What do you offer as part of the medical insurance? So they pretty much come and say, okay, yeah, they are going to offer me a medical insurance. They said it is an extensive medical insurance. Fine, my company also offers that, and I'm fine, I'm going. Once they are in the company, this is where the question starts. This is where the comparison starts. And this is where they realize, I don't know enough of what my past company was offering to me, and I didn't question well enough on what my new company is going to offer. So I think people are going to start becoming more aware, but I don't think that this is a predominant driver that is going to put us on a market as a more well-perceived employer of choice just because we are offering it. People still did not raise an awareness of what the well-being programs are and what the different companies offer in order to question and in order to perceive this in their heads as something that is super important for them when they are looking for a job offer. I'm not saying they shouldn't, right? I think they are learning as we go. And as the time will pass, the employees are also going to change how they perceive this. But at this point, I don't think that we are in a position to come and say, oh, we have an excellent well-being program in a company, and because of that, our housing allowance can be lower, but the candidates are still going to accept coming to us.
Okay, understood. Thank you, Ivana. Okay, I mean, this brings an end to our panelist discussion. I want to thank the panelists for the great insights. Before we move on to the Q&A, I wanted to maybe summarize some of the key takeaways and actions that employers can take to create, if you want, healthy people and healthy businesses, I guess. Some of these are the fact that companies must update their cost containment strategies to accommodate claims trends. And again, when I say cost containment strategies, I don't mean just slashing benefits down. So really putting an effort into reviewing, having a long-term strategy towards cost. The effort and the education around utilization of digital health and trying to mitigate as much as possible trends that are expected for this year, and I suppose may continue for the coming years. The plan design review and offering that well-being and mental health, like Andrew S. mentioned, if it makes sense, depending on what the data tells us, it could certainly improve productivity, increase retention, and potentially position an organization as an employer of choice, although obviously Ivana mentioned that it is not a main driver when it comes to attracting talent today. And I think the key point that I would like to take away from today, and in order to support all the changes that we've just discussed, is data, right? So accessing data that is specific to your policies to allow you to make informed decisions and ensure that any changes that you make have the required impact medium to long term is critical. Making changes is very easy, but often these changes don't make or don't have any impact on your cost or on the well-being of your employees because it is generic changes, they're not targeted changes. So that's again something that for me is critical. For more insights on the report, please visit our Health Trends Hub on marsh.com. You will be able to also ask follow-up questions through the websites, I believe. Moving on to the Q&A section, and we've got a few minutes left. I've seen that Andrew, both Andrews have been nice enough to answer a few of the questions already on the chat, so I may not come back to those. We had two questions that came in prior to the webinar today that potentially I would like to cover, and obviously any follow-up questions that you may have, again, please route them through the website, or any questions that have been asked today here that we've not been able to answer, we'll make sure that we're able to come back to you with some sort of feedback. It's the question is, do you think organizations know the true cost of their employee health and benefit plans? And I think it would be good to kind of hear from both Ivan and Andrew S here. And it's the question is really directly into, you know, what are the consequences to the benefit plan that you've got today from a direct cost, but potentially indirect cost that may be associated to a poor or a very rich benefit plan today. Ivana, do you want to start?
I'm seeing Andrew already started, so let's go with the mail first.
Andrew, go ahead.
Yeah, thanks, Ivana. You know, look, I think probably the answer is going to come better from Ivana and from the MMB team, because I think this is a critical component of you know, comp and ben and HR strategy. I have a view of this being close to our comp and ben and HR teams at MetLife, and I've had a view on this having worked in a number of global markets. I will generally say that my experience in, let's again say, you know, the Gulf region of the Middle East is that there is very little transparency as it relates to healthcare cost because of the nature of how associates and employees and their families receive insurance benefits in this region. Generally speaking, 100% of the cost of healthcare and benefits like life and disability and or dental and critical illness are generally paid for by the employer. And I suspect there's a small percentage of employers that communicate what this cost is, but largely I would imagine that most employers don't communicate it in their, let's call it, total benefits compensation communication packages. At MetLife, we have a total compensation document that's sent out to us each year that shows all of the benefits we get, whether it be retirement benefits, benefits that MetLife pays for health insurance, et cetera. And so there is that visibility there. And I say that this is different, but it's the reason why I just mentioned. Now, I do feel like this has an impact on consumer choice when it comes to receiving healthcare. So if an employee doesn't understand the cost of the health insurance plan that the employer's affording them, and the only mechanism for driving consumer choices of where they seek care is maybe a 10% or a 20% copay at best, but not necessarily the premiums they pay out of pocket, out of their payroll, then they're less inclined to make a decision of where to seek care, whether it's in a hospital setting or a clinical setting, whether it's the most expensive provider in the region or one that's more comparable to the middle. And I think this has an impact on trend, medical trend. It has an impact on cost of care. And so I do believe that employers who want to control cost, but at the same point in time want to provide very good benefits in the market, should consider being more transparent with their their members with what is the cost of care? What are we paying for? And why do we make decisions then to impose benefit plan changes that control that cost? Why are we making changes to increase copays or remove a provider from the network that is costing the plan a lot of money? So it's a balance, I get it. And I think that's probably where Ivana and MMB probably have a more holistic view on the pros and cons of being that transparent with employees.
Ivana, anything to add to Andrew's feedback?
I think pretty much that Andrew structure is rather well. The more we inform our employees about how their choices impact their medical insurance in the end of the day, and how much copay they have, how much how big the table of benefits is, we better control the cost. But the one element which I would also like to emphasize higher is that we also need to start working more with our medical insurance providers and or brokers on trying to influence the medical institutions, the medical providers, and in what they really do and what they really provide to our employees once they get to those institutions and to those places, because a large cost is also coming from let's do this test of a blood, although your knee is hurting. And I think that in a longer run, while we will on one side have to educate our employees and inform them about what is impacting the cost, is a long discussion in how the medical providers are providing the healthcare to our employees.
Thank you. Unfortunately, it's all the time we have for today. I think we could all sit here and speak for hours about this topic because it's what we do and live for every day. There are a few questions that have been posted on the chat. So what I will make sure is that we come back to you with feedback on whatever specific questions may have been posted in the chat or the Q&A option. Sorry, we couldn't go through all the questions. Once again, I would like to thank our panelists and obviously all attendees for your time this afternoon. Have a wonderful summer, everybody. Thank you, everybody.
Thank you. Thank you. It's been a pleasure.
Thank you, everyone.